We're turning to focal question 4, monitoring children who are or were outside of family care and evaluating the impact of the program and systems intended to serve them. Small topic. And we're going to start with Alastair Ager, Professor of Clinical Population and Family Health Program on Forced Migration and Health at the Mailman School of Public Health at Columbia. And then the recommendations will be from Kathy Zimmerman, Senior Lecturer, Gender, Violence and Health Center, Social and Mathematical Epidemiology, London School of Hygiene and Tropical Medicine. So, Alastair, so long.
Yes, we have long titles, and we had a long question, as Joan notes here. And also wanted to note, I was not able to join you yesterday, and I know that a number of the discussions that we'll be touching on in this paper were also alluded to yesterday. So as I think we saw from the first session, there's a number of emerging issues that connect across these 4 focal questions. But each of the focal questions gives us a chance clearly to focus our discussion, and essentially we're looking at monitoring and evaluation. Monitoring in terms of the focus and current performance of programs, and evaluation in terms of their broader impact. I want to just use this figure, which informed a little bit of our thinking in terms of what we saw the distinctive role of monitoring and evaluation to be. And if you just focus on these words, first of all, there's essentially 3 aspects that we thought that information was relevant in terms of our broader thinking about a child protection system in terms of children outside of family care. First of all was about accountability to donors, but also to beneficiaries and to communities in terms of the commitments and the delivery of what has been undertaken. Then very much, although it's an obvious thing to say, monitoring and evaluation that informs program revision development, that this is information that is not for someone else, but is for those people involved in program delivery, that it is helpful for them to shape the precision and the impact of their work. And then clearly, ultimately, and this is something we've talked on already this morning, and I know was talked on yesterday, the whole notion of information that really helps us as a field, that we've really understood something, and for future programming we stand on the shoulders of others in our thinking. So those 3 themes, those 3 key principles, accountability, informing program development, informing future programming, are what we see as the key contribution of M&E and focal question 4 to the other focal questions and to the broader considerations of the group. And this isn't perfectly matched, but you'll see that there's somewhat similar arc through those things to, yes, acknowledging that monitoring activities have been accomplished is important, it has its role, but let's look at the energy that we invest in that compared to then confirming that those activities have led to tangible and valuable outputs, that those outputs have had outcomes in the lives of children and their families, or their provision of care arrangements, and then the impact longer term on these broader issues. And so that's the other arc that we're talking through, is moving our monitoring and evaluation concerns from acknowledging that have we done what we said we would do, to is what has happened something which has impacted the lives of children in an appropriate way. This is the sequence of work that the group has undertaken. It's very similar to other groups in terms of the pre-summit discussions, the refinement of materials, identification of a structure to describe that. And one of the key points of putting this up now is that clearly we're some way along this figure. We're around here now at the summit, but this is not the end of the line, quite literally. And there are 2 things that are very important that I want to draw your attention to, which your attention has been drawn to regularly, but it is the yellow and the green cards. This is a partial analysis. Everyone has acknowledged the pressures, the time pressures, the constraints in terms of this analysis. So it's a huge opportunity for us to share an initial formulation of issues and initial accumulation of evidence, but also with your inputs to supplement that. So if from reading the paper or anything I say you feel there's important evidence that you think that we have missed, that's very much what your yellow card is for, and we really are eager for suggestions and contributions that we may otherwise have missed. And then clearly this is not just to then document in this report, but to lead on to a broader process of formulating general principles and action plans for the future. Another way of saying that is in terms of starting with 80,000 documents, 71 were identified through the relevance screening, additional 28 documents were identified through the team members, 58 papers in total from that, with the focus of what I'm going to describe over the next few minutes. And importantly, and I think it came up in discussion this morning, of those 58 documents, there's two groups that we want to talk about. 39, which presented specific models, systems, or strategies, if you like, evidence in that sense of reporting data on particular interventions and strategies and so forth, but also 19 documents which we could see as some sort of expert guidance, and quite often some sort of quite considered consensual process into this to acknowledge that field practitioners working in a number of fields over a number of years do accumulate wisdom, and that are ways of aggregating that wisdom to provide some form of evidence. And so I'll separate the comments on the 39 papers from the 19 papers, although I think they broadly take us in the same direction. So we wanted to try to make some sense, particularly about that first 39 papers, a number of approaches with that broad arc of monitoring and evaluation. You can imagine there's quite a diversity of papers within that sample. And we identified two dimensions in which to group those things. One was whether the work, really what its focus was in terms of who it collected data from. Now, clearly, some studies were talking about individuals that were being recruited into a program, that the focus was small, but they are named individuals potentially benefiting from a service. Others, the focus was on data from groups, and acknowledging that that group represented, or we were learning something from that group that we might generalize to the broader needs for programmatic development. It wasn't just the people that were assessed that were going to receive an intervention, but a sample of those people. So some studies looking quite explicitly at broader populations. That might be a national population, but it might be a district population or a refugee camp population or whatever it might be. But to be clear that one of the dimensions that we can sort on is who are we collecting information from? Is it a cluster of individuals receiving a service, or are we trying to make a judgment in terms of a broader population? And the other dimension we were able to use was really the time scale of these interventions and how and when the focus of their completion. Some were one-off. It's a one-off assessment measuring individuals, groups, or populations at a particular point in time. A number were episodic, typically pre-post, before something and after something, and some, as we'll talk about, were long-term, a commitment to regular data collection over a long period of time. If you accept some value in those two dimensions, we get a number of cells here in which we can identify a number of typical methodologies. So we have screening assessments to go into programs or understand the needs of a particular group of children outside of family care that have been identified, broader needs assessments within groups, potentially prevalence surveys at a district level. And then moving this way, project evaluations, looking potentially at the end of a project, comparing outcomes pre and post, and then longer term around longitudinal research, looking at case management systems and longer term follow-up of information through the life course, certainly through a period of intervention and support for children, to broader population level things around national representative surveys or collation of routine data collected by government systems. So that's the sort of range of information that was collected within the sample. If you've read paper 3, I'm not going to test if you did or not, but if you read paper 3, you'll know what the numbers are, but let's just reveal them here. So in terms of the data, the number of papers falling, you'll see immediately that a good deal of the focus was in these one-off assessments with different groups, and we have rather less up here. So I think that in itself tells us something which chimes in, I think, with discussions yesterday and also this morning, that our focus tends to be quite short-term, tends to be on what the situation is now. And although we know that a connected child protection system, we know a broader lifespan perspective is appropriate, although we know developmental issues are crucially important, the way that we measure things tends not to reflect that in terms of longer-term commitment. In terms of the findings from that paper, I just wanted to draw basically 4 observations from this group. First of all, to focus in this area. And so it's clear that in the field, in terms of monitoring and evaluation, we have a a good diversity of measures, of tools, to see the circumstances of children. There were a broad range of measures here in terms of children's social and emotional adjustment, in terms of children's physical adjustment, in terms of a range of potential indicators. We are not short of good practice and evidence in terms of measuring how kids are doing. If we want to be critical about this, when we just look at this sample, and again, I'm happy for you to suggest on the yellow cards other things that might go in that pile. If we're critical of it, let me just put, so we were saying that tools are available for assessment of children's needs. That's an assertion we can make. If we want to be critical of this, I would suggest that the evidence we have suggests this about speed and scope. A number of these measures were good assessments of children's well-being, but in terms of particular circumstances, particularly emergency contexts, when that data is needed to be able to formulate quite promptly programming priorities or the response and the formulation of an intervention, it doesn't look like, or there was no evidence that this data had been used to really get in right at the beginning and to shape in terms of a rapid assessment of the current priorities or the appropriate priorities of programs. And similarly in terms of scope, and a somewhat contradictory thing with this, that interventions tended to focus on social emotional or economic livelihoods or physical health, rather than be a more comprehensive assessment of children's needs that systemically would inform potential priorities. So essentially we're just concluding from this evidence here that we have many tools, there's a richness of capacity and potential there, but in terms of being able to deploy that evidence base promptly in an appropriate range of settings, there's still work to be done. If I highlight these two cells in terms of assessment, and I want to just show the conclusion we draw from that: rigorous evaluations can establish the outcomes and impacts of provided assistance. Again, I think this was reflected yesterday in discussion, also this morning. It is not now common to hear people say, of course, there's no way of measuring whether we're doing any good or not. Child protection, the well-being of children, support of alternatives to family care is not something measurable. That is not in our vocabulary. There is a sense to which these are things that are measurable. They can be challenging to measure, but we can develop methodologies to see whether particular programmatic interventions have had impact. And there's a broad range of studies which are just, I'm sure, again, a subsample of a broader range to show that there's a developing sophistication in those designs to, in an ethical and efficient and appropriate way, look at issues of representativeness of the children that we're dealing with, and understanding some examination of the counterfactual situation of children that don't receive particular forms of family support, comparing that to those that receive a particular intervention. So we think that's a strong area of evidence. I think Kathy Zimmerman will note later on, it's still challenging in terms of programmatically arranging that and supporting financially that, but we know we can do it. The field can do that. Although that sounds a very positive message, I want to use a slide of some work that our group has been involved in as a transition to the next column, which is the longer term issue. And this is data from a well-received evaluation of a Save the Children in Uganda program supporting children through a school-based intervention with children that had been displaced from their homes, and around 20% of the children had been abducted. And on the left-hand side, you see at one stage, at one point, and then a year later, after they'd received a school-based intervention, scores, actually this is their parents' judgments of their social and emotional well-being. And so the good thing, the achievement, is that that left-hand figure shows that things go up, and those children have higher levels of social and emotional well-being 1 year after 1 year being engaged in this program. And even better is that that curve, that slope, is higher on the left-hand side than on the right-hand side, which was for children who in every other way were matched, but they were in schools that the program had not had resources in its first year to roll out, and so was in a waiting list control, if you like, for potential implementation. And so from a programmatic perspective, this is a rather nice study to show that this intervention had an impact, a greater increase in social well-being than children outside of that program. But if you look at this data in another way, in a more systemic or more child way, there's two other stories that are really important from this data. So the intervention, if you own it, had an impact. But you can also look at that and say, on the right-hand side, children are improving anyway. That's good news in northern Uganda. That's great. There are other things within the system, within the community systems, that are supporting recovery. Let us not deny that what we're doing is adding to, perhaps contributing a little acceleration to a process that's happening within communities in terms of the strengthening of children's well-being. And so the fact that things happen without our interventions should be a great encouragement to understanding the broader influences on children's well-being. And that leads to the second point, is that those little grey lines behind are the individual children before and after. And although we can run the stats and I can persuade you with those hard, heavy lines that things got better with the investment of the intervention than they would have been without the intervention, that's true. We know when we look at those lines that we see a huge range of children's trajectories over that period, that we're having a net impact. That's really important, but let's not pretend that those two single lines tells the story of children's experience and their recovery and support. To untangle those influences over time, I'd argue from the data that we really do need to follow up children over time and understand over a period of time how things move forward for them and what are the influences outside of particular interventions, and to be able to identify longer-term influences on trajectories and outcomes. So on the right-hand side, we have the longitudinal research studies, which I think were mentioned on yesterday morning or yesterday afternoon, and that's one important contribution. I think it's interesting we can only find one example where essentially existing data used to manage, in the case management of children, was then mined to see what progress had been over time. Yet surely a good program collects such data and information over time, and we can learn from that because it's good monitoring and that can inform us. And then more broadly about there's some interesting work beginning to discussions around using national population data, what questions can be asked, what existing government data is collected that would give information over trends over time. That's the third area then in terms of investing in some methods to identify longer-term trajectory of children. The fourth point to make, and which is this one, is that I was just saying to Bill at the break, what this diagram does not display is an integrated system of information management regarding the well-being of children. It looks like what it is, a number of isolated attempts, some project-focused, some preliminary, some longer-term follow-ups, but the connection of these elements is not very explicit. And it's not mindfully done in terms of how those needs assessments, we found them, but have they fed into broader planning in those areas? Has that data been compared from different areas? Have we mined that information and shared it effectively? And I think there are some promising examples. I was just talking with Santi, Indonesia, in terms of the government of Indonesia's commitment to looking at the data collected across a number of ministries and bringing that together in a more effective way to plot the circumstances of children over time. To conclude, to wrap up with just 5 slides in terms of these particular issues, that was the 39 database papers, if you like. But as in many other areas, there were a number of resources that were full of wisdom and expertise. These are the issues that when we looked at them, the rest of those papers, over 20 papers particularly, are reflected on. And I just want to highlight 5 of the issues and again use this idea of the proposition that comes from that. The first of all is this proposition that protective factors and processes of resilience are important in understanding children's adaptation. And hopefully in this room that's an uncontroversial one, but we've tended to measure adversity, we've tended to measure risk, we've tended to measure dangers, which is important, but less commitment to measuring resources that are vital for children individually and as a community in terms of recovery. And this slide, which is in the paper from a colleague here, Kathy Zimmerman, begins to plot out how, given, yes, these are risk exposures and these are what the indicators are of a child doing well, but there's a whole range of issues in here from parental, maternal influences, individual influences, peer, community, etc., that are really potentially vital in helping our understanding of the long-term trajectories and support for children outside of family care. The second issue is that communities are an important source of information for monitoring, and again I think that was already mentioned again this morning, I think it was recurrent yesterday, that we're not necessarily talking about state systems or research systems. That might involve that, but the community itself is an important resource of measuring things, whether it's in terms of child labour and the work of ILO, the whole look at community-based child protection systems. Important acknowledgement that that sort of data, that often the community knows significantly more than those outside of community contexts. Caregivers are a key focus as well as a channel of monitoring. This came up in a number of papers that whilst we can see that caregivers can give us information on things, caregivers are a crucial part of the delivery mechanism for the care interventions that we're talking about. And a number of papers were looking at how we can best support such care workers, caregivers, and to see that the support for them is a key indicator of the quality of interventions. A number of papers made the point that while in measuring things, and stigma was mentioned before the break, we may want to put kids into categories and this and that and so forth, we should acknowledge that those categories don't just remain in our log frames and in our results frameworks. They go out into communities, they label children, they give children identities which may not be helpful for them. So we need to have a caution in terms of the way that we prioritize and categorize children in a way that to ensure that that does not create any form of stigma. And then finally, children can and should be active in process of monitoring and evaluation. And again, that came up in questioning beforehand, but to see that's a key part of the strategy in terms of incorporating all sources of data in effective monitoring and evaluation. That's our timeline. We're working towards the end. We'll be talking about recommendations in a second. You have the paper in front of you. I hope you've written something on yellow cards if you think it's missing. We're happy to take clarifications now, and then shortly Kathy will be taking discussions of your recommendations, the things as you hear that, as you see that evidence, what implications you think it has for policy, practice and research. Thank you.
Very thoughtful presentation. Comments, thoughts, as you saw that it was really helpful to see how many in each category, to put those up there. Comments or thoughts? Go ahead. People should just come to the mic, so got runners now. Coming to the mic.
I'm Catherine Patrick from Yale University.
A little bit louder.
Sorry. Catherine Patrick from Yale University. There's a recent, I applaud the presentation for longitudinal work, and of course noting that children can actually get better without intervention, so that understanding the range of trajectories is far more important than knowing how to get from A to B, maybe. There's a recent book on resilience by Michael Ager called Handbook and Practice, which defines the central mission of resilience research as identifying the critical turning points that will flex children back into healthy trajectories. And I think that's a really important new book in 2011 to bring to the resilience discourse, which says that the mission is to identify what resources are critical to make those trajectories flex back towards some kind of healthy development. So that's really the focus of resilience research, which I'd like you to emphasize just a little bit more, if possible.
So thanks, Catherine. And I think the word trajectories is a very useful one to reinforce that notion of understanding what the disruptions to children's well-being is through lack of family care or disruption of family care and other options. And trajectories forces us to have a longer-term perspective and to realize that there are a number of things happening over that life course, over that time period, during which a trajectory is playing out. And I think that's where resilience very much comes in, the multiple systems that influence that. So to go back to that figure, I'm not ashamed of that evaluation. I'm glad to show that one little bit of the picture made a difference. But it's so easy to tell that story as if that's all that happened. That was it. That was the intervention. Whereas in fact in those children's lives a whole lot of things are going on, a whole lot of influences. And ultimately we're trying to think of what are the ways of bolstering resilience and longer term impact. Thanks, Catherine.
Go ahead.
I'd like to support the last speaker. I'm Florence from Oak Foundation. Resilience, please, more and more. My own foundation is doing some research in Ethiopia, Bulgaria, Nepal on resilience related to sexual exploitation. It's unpublished as yet, but we'd love it to contribute to all the knowledge on resilience. But what I wanted to say here was a great paper. I'm representing a private foundation. There are 2 or 3 other private foundations here, and we're really grateful to be in on this and listening to, the state of the evidence. I just wanted to point out that private foundations are trying to work together a lot more in terms of child protection issues in general. We had a meeting in London. We hope to be doing a lot more together and seeing how we fit into all this emerging agenda. And in relation to monitoring and evaluation, one of our first initiatives has been to pool some funding for an evaluation challenge fund. And that's recently been set up this year. There was a call for proposals. It was overwhelmingly successful. Hundreds of proposals came in. And we're down to a short list, I believe, of 22. So I think the good news is people are ready for looking for more robust evidence. And if there are ways we could all work together to pull more funding to enable that to happen and support the work around the world, it would just be great, okay? So look out for the Evaluation Challenge Fund. If you Google it, the first issue they're looking at is violence and violence in the family. But some of these issues will obviously come into that in the future. Okay?
Thanks, Florence. And I've actually been working as an assessor for that program, and I too have been moved really by the enthusiasm and the commitment of field workers to seeing the impact of their work. And I think this, not evaluation for others, but evaluation for yourself to see that you're doing helpful things.
And Florence, we're really happy that you stood up and said that, because we were just talking earlier about we knew that the foundation community is looking at the evidence, and if there's a way that we can tie these 2 efforts together, I think you're key to that, and John and others. Okay, other comments? Thoughts? We'll take a line. We'll have a little line. It's fine.
You talked about the sparsity in your sort of upper right-hand quadrant of research in terms of sort of population-based evaluations and large-scale evaluations. And I guess, and I just looked through the review itself just to sort of confirm what you were talking about. And I guess one of the things I'm wondering about is there any ability to incorporate maybe examples from other fields and or some methodological notes about some of the issues that would be associated with that type of evaluation as a part of the process? In as much as that's such a lacking area, I think it's a little difficult to get one's arms around in terms of what's really meant by that and how it can be accomplished.
So the way I respond to that is that it is a lacking area by the time it comes to this point, but I feel there's huge resources in there. So let me just use a couple of examples. I believe there are a number of projects that take meticulous records in terms of the experience of children, the sessions they come to, how they're doing year on year. For good, understandable reasons about protecting identity and so on, there's not a culture of that data becoming anonymized and being made available to understand the trajectories of children over time. 80% of the work is done by social workers and care workers having kept good records over a period of time. But we don't use that. We haven't had a culture to which we can mine that one study I mentioned, use that word, had mined data that have been kept to be able to look at lines. I mean, if we go to the top right-hand corner, governments collect data through national census bureaus very regularly. There's a way of doing that. That happens. But do we as a community articulate what would be the key questions to add to an existing census or an existing population base to really give us valuable background information in terms of, in this particular instance, the circumstances of children, the care arrangements of children, the changes in the care arrangements. So I'm not that discouraged. I'm thinking it's just the last mile or the last half mile we need on that top right to push home the potential that there is for the data that lies there in ministries. I was talking to Santi, and the government of Indonesia is making some steps, as I said, to collate information from different ministries, to collate into a single report around child protection risks. And a lot of that data is already there. Some major data gaps also, but I think we shouldn't be too discouraged. We should be committed to mining information that we already have.
To emphasize that point, the government of Brazil, about 10 years ago, I believe, started on a campaign to educate their primary health care workers about occupational injuries and illnesses of children, to recognize them. Because one assumes that children are not going to be suffering from such, one assumes that they're not working. And this was a massive educational and training effort in order to get the data. And well, let's see, as of 5 years ago, 37,000 people had been trained, frontline workers. And this has now become a model for much of Latin America and now other countries as well. What happens then as a result is that the healthcare records of hospitals, primary healthcare clinics, and so on are now accessible, are giving us regular data of, that are objective and are well informed. And it's an example of where this has been achieved as a result of a policy decision and a recognition of the problem, which is, I think, what we're doing here.
Thank you.
My last comment now is about resource tracking vis-a-vis monitoring to inform policy practice. Because one of the issues which is important is the cost of implementing a particular type of intervention. And that is very key, particularly for low-income countries. And putting a cost to an intervention or monitoring and cost assessment vis-a-vis what is being delivered is very key to donors and also what to be, and the preference of some interventions. Why people do this and don't prefer to do this, and the cost of inaction also has a bearing on the cost. So did you find studies around that? Are they reflected? Because I haven't heard about resources, monitoring the utilization of resources and why. And it's a subject which needs to be infused within the monitoring because it's very important. Thank you.
So thank you for the question. I'm looking for Kathy. From the papers that I reviewed, I think zero. I didn't see any analysis of cost data. And I want to give two responses, which are almost contradictory, typically as an academic. So one is that I completely agree with you, and that, for example, that data again I showed you, is that difference enough of a difference to invest in that program, that from the intervention to the schools that didn't have it? Is there an economic argument in terms of the benefit of that? The reason, the caution though, and again let's go back to the discussion I was having with Bill, in the health sector I think there's been a real danger of assuming that health is responded to by a discrete set of interventions, like on a supermarket shelf, and you take this one off and it costs so many dollars per deli, and this one so many dollars per deli, and you can just mix and match, and that it's just as mechanical as that, as if the health system is just about delivering interventions. I don't think that's true in the health sector, but I'm certain it isn't true in the child protection sector, that you could identify the cost of an intervention and believe that it just is a standalone thing. What we're talking about, I think, is the multiple influences in children's lives and the complexities of those. And we very much want to see the way that systems reinforce and build on each other, rather than necessarily expecting that each system we could divide into the various components that are standalone components and costed independently, which I think really the whole is more than the sum of the parts. So I'd encourage moves in that direction, but I think with a caution that we're not going to get the answer just from economists in terms of which is the best option.
I was really delighted to see the inclusion in this group's report of how critical it is to provide support to the caregivers. And you did a nice job describing what the Bucharest Early Intervention Project had done. I'm aware of comparison data on that particular topic, which is hard to come by, and it comes out of a project that USAID and Russia funded, and it's quite striking. In 2006, the Russian government decided they wanted to close 30 to 40% of the orphanages over the ensuing 4 years, and had a big kickoff conference to do that. And USAID was able to provide support to 4 regions, financial support for the caregivers to be supported by social services in this process of fostering kids who are often older and who have lived in institutions for a good while. And so during the 2-year period that the support was provided to the families, none of the families from those 4 regions gave the children back, quote unquote, to the orphanage. And they compared it to what the experience of the rest of the country, and approximately 20,000 children in the rest of the country were returned to institutions during that same time period. And I don't know the denominators of children's placed, which of course you would like to have, but I think it is in that report, and I have heard a very compelling presentation about it. So it's evidence that you want to probably consider, but I thought because it's so difficult to get a comparison group that it would be interesting for everyone to hear.
Thank you very much. And please make sure it's on your yellow card.
Over there in the mic, and then we'll close it out with.
Thank you. Well, just following up on what Alastair was saying about Indonesia, I think when it comes to, well, there have been some discussions about the options. Would it be better to just sensitize the existing mechanisms to be able to accommodate these needs of having child protection concerns into the national surveys? Or is it actually we're compromising the quality of data if we go with the first option? But I think we need to consider both directions. First is maybe like some poverty data can also help us identify children at risk of first form of child labor, for example, but also creating new mechanisms in which prevalence can be prevalence data on child protection concerns can also be gathered nationally, I think. And then my second point is that we also have to be mindful of the need of having national capacity of doing this mechanisms. And the government actually also has mechanism in doing monitoring of programs, but they have maybe like very short time, like 3-4 days at the field, and maybe what they need is actually for us to support them with finding the best way, the best tools, the best method to make use of those 3-4 days in gathering the necessary information.
Thanks, Nancy.
Excellent points. I don't know if there was something that came out here. Go ahead, Jeff. Go ahead. So what kind of support was given to the caregivers?
I can find out more. I don't know the full story, but I do know that there was in-home visitation regularly by the social worker to find out what were the problems the parents were having and to help give them skills with dealing with the problems with the children. So, but I could find out more.
Bob?
I don't think we've paid very much attention to the issue of sustainability. There is a literature on sustainability and how to sustain projects. It's quite a bit of common sense. The problem is it's not commonly done. The first thing is that you've got to involve all of the major stakeholders from the beginning. This includes people with resources, but it also includes program directors who are likely to implement this in the future. Because unless you have a committed director of services, you're not going to get a new program established. Next, the intervention needs to be planned so that it is sustainable. Things like train the trainers instead of just training the folks, so that they can train replacements in the next generation, and so it snowballs. You need an internal system of supervision and monitoring, because training does very little good without constant supervision. Even hand washing in a daycare center does not get done, which does not take a lot of training unless there's a supervisor that insists on it. And lastly, in this regard, you need to construct an intervention that can be sustained financially. We often throw the book at interventions, do the best we can,
That's good science, but ultimately, if it's going to be sustainable, it's got to be pared down to something that can be afforded. After the demonstration, you continue to need monitoring and supervision. That's why the locals need to do this. Another strategy are implementation teams, people who have been involved with the original project who can then go out to other neighborhoods and help them implement that project. And finally, and not to be minimized at all, there needs to be a professional infrastructure that we've mentioned several times in several groups that can support, that can train, and that can provide additional technical assistance as projects expand.
Oh, very specific comments and helpful. Last comment before we go to the green cards.
Just thank you again for your very good presentation. I just want us to bring children at the center of monitoring and evaluation activities. First of all, as an aspect of capacity building, because more often when we talk about research, you also realize that children have been marginalized when it comes to involving them in research. So my question is, from your review, did you come across any methodologies that involve the children and also putting them at the center of this type of activity?
Yeah, thank you.
And the reason I'm bringing out this is that I got involved in the work of some organization, and this is LeadTrack. Now, LeadTrack works with street children, and somehow I looked at their processes, and they used them more actively in identifying street children and also in assessment of their progress over the period of time based on the interventionists that they were using. And I felt this was a very good approach. In a way, it was making them more involved and also building their capacities. So maybe there could be other good practices we can learn from. Thank you.
Thank you. And just to say, I completely agree. And I should have said in that left-hand column of needs assessments and so on, there were many examples of quite good participatory assessments involving children. My sense is that we moved a bit to the right to evaluations. There's less good examples of continuing with children. So that again, it's rather than a one-off engagement of children to get their perspective, to actually recruit them in the way that you were saying as participants in evaluating an intervention or activity over time.
Oh, that's a very important point. And I think we need to make sure we incorporate that, because otherwise, as you move more towards evaluation, we'll lose that perspective. So why don't we take few minutes, less than 5 minutes, to do your green cards. What are the recommendations that come out of this presentation before we hear the recommendations from the group? Thank you.